Uh, So I figure we'll go around and have folks introduce themselves, and there's some updates that I think are out there. One of them is on vending machines, but I don't see Jim Novelli here yet. Let's start with Chief McCurran.
Hey, everybody. Chief Tim McCurran, Coolstein Fire Rescue in the South End.
Anything exciting going on down there?
Try that again.
I said, is anything exciting going on down there?
It's been a busy 3 days. This has been a busy week for us. We've had a number of accidents and fires and everything. So the crew's staying pretty doggone busy. So it's nice to sit at my desk, and I've been kind of staying in my command car and seeing lots of the sheriff's folks. We've been kind of being buddies this week. So other than that, nope, that's what's happening.
Okay, well, good to hear it. Sheriff Knoll.
Joe Knoll, Jefferson County Sheriff, everybody.
Hi there, Cherish.
Hi, everyone. Cherish Kron, Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Callahan counties, making good progress on our Seventh Haven project, which stands at 23% complete. I will share in the chat pictures if you haven't been party to being able to look at those. I keep those up for the public, along with phase 2 of our open air shelter project, going along quite nicely as we look to apply for funding for other things. So yeah, I think that's
Thank you. Lots of stuff going on. How about Judd?
Yeah. Hey, Lori, Judd Haynes, navigator with the Port Townsend Police Department. We're talking about exciting things. Sorry, I missed that.
Anything you want to tell us, Judd, we want to
Constantly
hear.
exciting here. No, no significant updates or anything super exciting. So.
Okay, well, we'll await your next entry onto the excitement landscape. Jolene Kron.
Hello, Jolene Kron, Deputy Administrator and Clinical Director with the Salish Behavioral Health Administrative Services Organization. Too many exciting things to really talk about, but I am on the agenda today to talk about one of them. So.
Good, and you'll notice I put in a bunch of programs that we didn't get to last week, just in case we have time. Anya.
Hi, my name's Anya, and I'm a social worker and a consultant here in Jefferson County. And I'll be up on the agenda later talking with Lori about harm reductions communications action plan that we're working on.
Thank you.
I had to look at that.
Go ahead.
I'm trying to do too many things at once. I'll pay attention.
All right. Leanne.
I'm Leanne Peterson, and I am the R.E.A.L program manager at Discovery Behavioral Health. And exciting thing is we helped somebody get their that was homeless get their pet into the vet for free. So that's a nice program.
All right. That's good to hear. Lisa Ray Thomas.
Hey, good afternoon, everybody. Lisa Ray Thomas with the University of Washington Addictions, Drug and Alcohol Institute, and I also work with the American Indian Health Commission of Washington State. As Lori said, we have a lot of stuff going on at ADI right now. So Lori, I will send you stuff to distribute to the group rather than go over it all right now.
Okay, cool. And you'll notice in the eVite, I at least linked in the latest syringe services program survey that they've just completed. Apple Martine.
Hi everyone, I'm Apple Martine. I'm the director at Jefferson County Public Health. I'm going to have to leave halfway through this. So I just wanted to say that to you, Lori. I apologize. I have a statewide health officers meeting to go to. A lot going on in the COVID landscape, as you all know. Interesting things that are happening here at Public Health. There's never a dull moment. I think I might pass to Denise on anything that's really behavioral health consortium related. So I don't know that I'm gonna offer anything at the moment. I'm just interested to hear what other people are doing. We're busily plodding along in all of our work with COVID. Yeah, I think that's what I have for today.
Well,
I'm also lacking lunch, so I'm a little bit hypoglycemic. I apologize.
well, we'll forgive you if you turn off your camera, run get some lunch. Brian Richardson.
Hello, everyone. Brian Richardson with Dove House Recovery Cafe. What's going on here? We have 2 MSW interns who have been fabulous. We've been really happy to have them here. We've been connecting with lots of different providers. I'm happy to see all you guys here. We've had the R.E.A.L team come by. Thank you so much. That's been an excellent resource already for helping us, as we are trying to catch some folks in the gaps here. And I know all of the other agencies that are working so hard to get folks into treatment in particular. So to have somebody who I can call and say, hey, come sit down with so-and-so and let's make sure that we really get them over to the case manager at DBH or Safe Harbor, whatever it is, so we can get them, especially into inpatient and then back. And that's huge. We're not really case managers here. It's as for those of you who know and have been here, it's a kind of dynamic, milieu environment. So we can build those relationships and have some of those conversations, but to then keep working along with somebody, it's not really something we have the capacity for. So thankful for the R.E.A.L team. And then the other shout out I wanted to have was for the YMCA. They've put together a pilot project for us to hand out what they're calling Y tokens to get free showers for folks who need it. They do need identification and proof of vaccination, but we've been doing it for a little while now and it's gone pretty well. So just wanted to say thanks to those guys.
That sounds really good. Lots of good stuff going on there. Denise Baker.
Hi, everybody. I'm Denise Banker. I'm the Community Health Division Director at Jefferson County Public Health, and I most recently was involved in substance use prevention, behavioral health promotion across the county. And so I guess I could say, I'm sorry for the echo. I'm actually watching our doors right now at Public Health because I'm handing out free COVID test kits to people who come to our door. But at any rate, the most recent things that I've done in terms of the behavioral health landscape is and the prevention landscape is the coalitions in Chimacum, Port Townsend, and Quilcene have really started to take off. We've got a lot of mental health that we're funding down in Chimacum through a project called Positive Action. And then we have some assessments that are going on in Quilcene that are going to help us identify what kind of programming they want. And then in the Port Townsend School District, Holly McIlvaney, who is the student assistance professional there, has many, many programs that she started up through Project Success, which is also funded through this same prevention grant. And so all of that is going on. And then Lori and I keep up with each other and what's coming down this pike. And yeah, so that's where I am. Thanks, Lori.
Well, thank you for double timing between us and the front door there. Matt Reddy.
Hi, I'm Matt Reddy. I am one of the hospital commissioners, and I don't really have any updates, but glad to be here. Glad to see everyone.
It's good to have you here. Richard Davies.
Hello, so I'm Richard Davies. I'm the director of the independent nonprofit that does public defense for Jefferson County courts. We spend some of that 1/10 of 1% on the courts. I think it's better spent on public defense, public health, but I'm in a minority with respect to court personnel, thinking where that money should be spent. Thanks.
Thank you. Something to think about there. Okay, Chief Brummel.
Hey, Pete Brummel, Assistant Chief Training Operations, East Jefferson Fire Rescue. I'm standing in virtually for Chief Black, who is out of town for the week, and at the same time trying to finish a paper for a graduate class I'm doing by 5 o'clock.
All right. Well, you go multitask.
We could help you write it maybe, if you need some help.
Yeah,
Oh yeah,
sure.
I'll reference you.
Let's see, Gabby Cordell.
Why does nobody offer to do my graduate work?
I'll help you, Gabby. I'll help.
Oh, good. Gabby Caudill, I'm the clinical director of Believe in Recovery. What exciting things do we have? My life's pretty boring. I don't have any, that's not true. I don't really have any updates right now. Nothing's really changed. Still doing the RSAT program in the jail. Still working hard at getting people the treatment that they need, bridging that gap. And that's it.
Well, thank you for being here, Gabby. Beth Myers.
Oh, hi, everybody. I'm Beth Myers, Mat Navigator at Jefferson Healthcare. Can I be seen? Oh, I don't really have a whole lot. I started working with some patients with alcohol use disorder. That's been good. A couple of people made it into inpatient treatment after a long in and out sort of process. And that was wonderful. So that's the only update I have. Thanks. Glad to be here.
Good to have you here, and good to hear some of the alcohol treatment is happening. Appreciate your connecting on that front.
Thanks.
Okay, have I missed anyone? I am going to turn it over right now to Jolene. And Jolene, I can share the slides from here, or you're welcome to run them from there. What's easiest for you?
Probably easiest if you wouldn't mind.
Sure, sure. Let me just make that screen up here.
As I make that screen visible to myself.
I'm busily making you guys visible to me. Okay.
All right. So good afternoon. We've been talking about this program for several months. We started, I think, our first conversations related to the R.E.A.L program in June or July of 2021, anticipating movement towards rollout of this program. And so wanted to kind of give everybody the full thumbnail. We do have this brand new PowerPoint we just released this week to explain the program. Starting with Jefferson County, the program in Jefferson County is run by Leanne here at Discovery Behavioral Health. So just a little history on the Recovery Navigator program. You will hear it referred to as the R.E.A.L program, Recovery Empowerment Advocacy and Linkage Program. We'll talk about that in a minute. But this did come out of Senate Bill 5476 in 2021 related to the legislative response of the State versus Blake decision that required law enforcement to attempt referral for individuals with substance use or co-occurring disorders prior to moving towards charges. And this program was developed initially to meet that gap, to be that referral source. Though it took several months for it to come to fruition in the meantime, which has been a challenge. But so this, again, this program is intended to provide that referral and response for law enforcement jurisdictions to divert folks who may encounter but are having substance use or co-occurring related challenges that could be managed or diverted from the legal system. This is a LEAD-like program to increase diversion. This is not a LEAD program. We like to be very clear that it is a LEAD-like program, which means it is not driven directly by the courts or law enforcement. Next slide. So the R.E.A.L program, again, Recovery, Empowerment, Advocacy, and Linkage. We wanted to be clear as to what services and supports can be provided by this program. This program is driven by the principles listed here. So harm reduction, not requiring an individual to be in and maintain sobriety to be served by this program. It is trauma informed, culturally inclusive, and intended to be staffed by individuals with lived experience, providing connection to individuals on a peer level where the individual is at. Next slide. So we did have our plan approved, and we do have 5 teams across the 3-county region. Like I did call out, you will see East Jefferson County is Discovery Behavioral Health Care, and that is the phone number to access their team. Just to be clear, we call out East Jefferson because West Jefferson is actually covered by the teams in Clallam, as we see across our behavioral health continuum that those services are provided by folks out on the West End. Each R.E.A.L program provides at a minimum a project manager, a care manager, and 2 recovery coaches. Next slide. All right, so the R.E.A.L program is a community-based program providing services to individuals who are referred. The priority populations are individuals with substance use and co-occurring needs, with frequent contact with law enforcement or first responders, and individuals who have had challenges accessing services under a traditional model. So these are some of those folks who many of the community knows who aren't interested in going to treatment today. R.E.A.L can be used as an opportunity to develop ongoing relationships with those individuals and help steer them towards recovery and provide the supports that they need to be able to get the other needs in their life met that make movement towards treatment more successful. Referral sources, we do prioritize law enforcement and first responders, but this program does also take community referrals for these folks as well. And we have seen referrals from various sources, business owners. They are doing some outreach out into encampments and working with community providers. And if we have time, Leanne could probably speak to kind of where her team has been so far. Next slide. So this program is a voluntary program. So I want to be very clear, individuals who participate with R.E.A.L do so of their own free choice. It is client-driven services, so meeting individuals where they are at. So the individual identifies where their needs are and work with the outreach recovery coach to identify how best to get their needs met. 90% of the staff time for this program is intended to be in the community. This is, and we say 90%, really with the intent that folks are being met where they're at. And if that is, you know, down at the Safeway or out at the park, that is where services can be provided to them. There is no intention really in this program that they will be picked up and brought to an office for services. And this program also, oh, not quite, no time limit to these services. So there is the intent of this program is to be time delimited in that there are individuals who may, you know, have a couple of contacts, they get into treatment, they they say they go to withdrawal management, they end up in inpatient treatment, come back to the community, are engaged and move forward. Then there are those folks who may be contacted on an ongoing basis over a 3 to 6 month period by the R.E.A.L team as they are working on maybe getting an ID so that, you know, they can get a token from Dove House and go get a shower. You know, so we're starting where the individual is at with this program. And so that may take time to move forward. So there is no time limit. We don't say they can be served for 6 months in this program and then they have to move on to something else. So we will see that some of those folks will be ongoing in this program for periods of time. And the teams may provide, based on identified need, outreach and engagement services is kind of generally the first line, and then light case management, so assistance with some of those less intensive needs to help things move forward, and then also intensive case management for those folks who really do need a lot more support. Again, this is working with individuals with lived experience, and the intent is for their recovery coaches and case managers to walk with them through the process. So as your entities may see these individuals, you may see them accompanied by their recovery coach to provide them support and help them learn to access some of these systems and be more successful in moving forward. Next slide. So the minimum program hours during rollout. So this is intended to become a 24-hour program. I want to put that very clear. The minimum hour requirement right now is 9 a.m. to 5 p.m. Monday through Sunday. Some programs across our region are providing additional coverage, and we can let Leanne speak to kind of where her staff is at around that as well. But that is kind of the rollout minimum, so that an individual would be able to reach somebody via phone, or at least contact the program. If they're on the phone, we may end up on a voicemail, but that there would be active staff between 9 a.m. and 5 p.m. 7 days a week. And again, looking at a 24-hour response in the future. The referrals can be by phone, voicemail. We are seeing some other manners in which people are leaving referrals. We have gotten emails from law enforcement officers, those kinds of things. We are open to any type of referral. We do ask that we get the individual name or an identifier. An individual may not have a name or share a name. So any sort of identifier related to that individual, what the identified need may be, if that is obvious to the referent, and the location and contact information that is available. And contact information, both for the individual and the referent, would be preferable. And then the program also does require, based on the uniform program standards provided by the Healthcare Authority, a rural response of 60 to 90 minutes. And we do anticipate that this program does not just cover Port Townsend or just Kitsap or just Port Angeles. We are asking the team, and Leanne's team covers all of East Jefferson County, so may be called down to Brennan. So we may see some of these times based on where the team is at, be a little bit longer. Just want to kind of put that expectation out there. But the hope is that when they get a call, that they would be able to respond in real time to support that individual. Next slide. All right, the policy coordinating group. Now we get into the good stuff. So before I do this slide, I just want to see if there are any questions related to this program that I've shared so far, or if Leanne, there's anything you wanted to add related to the couple of things that we called out before we talk about this next portion.
Right, so we are available Monday through Sunday. I have the phone at home with me. I live close enough where I could respond in the time frame that needs to be responded in. We've worked with Chief Kron already, and Sheriff Knoll. We've worked with the navigator and Gabby and Brian. So we're building our relationships and getting the word out. So it's been nice to get to know people.
Sheriff Knoll, I saw you had a question.
Yeah, I just show my ignorance here. We have a referral form for services for the Blake and Senate Bill 5476, and it lists Believe in Recovery, Safe Harbor Recovery, Washington Recovery Helpline, and then it has a line for other. Could the recovery navigator, is that what I heard you say, Jolene? That could be a referral as well?
So absolutely, that actually this program was developed to provide for that referral source. The Washington Recovery Helpline was put on there as a stopgap as these programs were getting rolled out across the state. So we absolutely would work with you all to be added to that referral form. And we did have an appointment set up that was foiled by COVID to meet directly with law enforcement in Jefferson. So we are working on getting that back on the schedule.
Well, in the form, and it's a form that's used by us, the Port Townsend Police Department, and I think the State Patrol can use it as well, but it came out at the time when there was nothing and we had to come up with something, and we're kind of scrambling for who to put on there, but So I will make sure that at least we have that option added on there. And maybe we probably need to come up with a new form.
Look like Jim wanted to say something and Apple has a question.
I was just moving my hand.
Oh, okay. Looks like Apple has a question.
I do have a question, and I apologize. I did have to go get my lunch, so I may have missed it. I'm a little behind the times, but I'm curious. I can sense that the folks on this call, especially law enforcement folks, you know, they have a direct need and they have a direct now contact or conduit to this support. And like Joe said, put you in on the line there and make a direct referral. Can you help me gain a context about how, let's say, service provisioners such as public health in this case, who see clients who may end up in a situation where that is needed? Is there anything we can do to harness and amplify the message to our own client base? I may have sort of the context not fully minted in my mind, but Jolene, do you have any suggestions for other entities to promote this just in the general conversation of how people access services and support?
So I don't know if you missed that this program does also take community referral.
Okay,
so
I did miss it. I apologize.
If your staff do identify that you have somebody that you're like, you know, they really do need this additional support, we would encourage a direct referral.
Okay. So Leanne, we'd love to know or have any promotional or just sort of identification of the program that we can share here at Public Health. And again, I'm sorry if I missed that part of the conversation.
No, you didn't. I actually went down and met with
just a
Ocean.
minute.
I went down and met with Ocean the other day and sent him some promotional information. So we talked about mobile syringe exchanges, and I sent him emails about what the R.E.A.L program is all about. So I've got contact through him at this point.
Okay, excellent. Well, thank you.
And then Lori, I lost the PowerPoint. Okay. It's like it disappeared.
That'd be easier for us to see each other while we were talking.
Okay. All right. So if there are no other questions just about basic structure, I will talk about contacts at the end of this, and it is included in the slide. So one of the things we wanted to bring forward, particularly this group in Jefferson County, there is representation in this group specifically that aligns with one of the requirements of this program, which is to set up a policy coordinating group. And a policy coordinating group is a group of the community leaders who will develop and review any protocols related to how this rolls out specific to Jefferson County. So each area of, you know, we are running, again, 5 programs across 3 counties, and each area has very specific needs. We've always been aware of that as the BHC-ASO, and we want to respect the community needs. And part of this would allow for specific protocols developed within each community. So as Sheriff Knoll just mentioned, can we add your name to this list? I think that would be a great decision to be made by this group. We are just setting up these groups, and under the LEAD model, and again, we've said this is not a LEAD program, but it is a LEAD-like program, that it would include law enforcement and first responders, the R.E.A.L project manager, so Leanne will be co-facilitating this, community navigators and co-responders, treatment providers, and any other community stakeholders that are identified. And so we really wanted to bring this forward, and I was going to kind of put on the table today, if there is anyone here who is interested in participating in this policy coordinating group, please put your name in the chat, or you can reach out to me directly, and we can get you on that list. We are looking to set up the first one very, very soon, get that scheduled. And so we are trying to solicit participants.
So
please.
Most of the folks at this table would be interested at least in the outcome of those policies. And so do I hear you saying that if they to have input to these policies, you would be on that policy group?
Yeah, we are soliciting participation for the policy group, for this program, for the R.E.A.L program. And so we would love to have input from many community partners So this is our first send us your names. We do have some names already, and we'll be reaching out as well. Thank you, Richard Davies and Sheriff Knoll. And then I see Lisa Ray's hand up.
It may be too that the fire department, I know Chief Black isn't here today, but he may be interested in, I know he was really interested in having the resource sort of integrate with what's going on with his folks out in the field.
And I'll reach out to Chief Black, somebody from fire, myself, Pete Brummel or Chief Black, one of us will be on that committee for sure. Jolene, just let us know.
Wonderful, thank you. And just so everyone knows, you will also be receiving emails from Marty-Ann Lewis. She is the R.E.A.L program administrator for the ASO. She was off today, so I get to speak on her behalf, but I know she's been reaching out to everyone for a while now. And Lisa Ray, your hand is up.
Yeah, thank you. I'm sorry if I missed this already. So will the PCG, is it regional or by county?
So we are doing the PCG right now by county.
Okay, thank you.
So we will have one for each of the 3 counties.
Thank you, Jolene.
You're very welcome. Thank you for that question. Just taking down names. All right, and if we want to go to the next slide, then I'll explain kind of the next step as well. So the next one is the operational work group. Again, a lead-driven process. And the operational group is really about the community partners who are coordinating on the ground. So this is a work group that, again, includes similar like kind of on the ground staff from the same entities that are a part of the policy work group. So the policy work group is really meant to be leadership, shaping kind of how we navigate this process. And the operational work group is really meant to connect in what is happening on the ground, how are we making sure these things are covered, how are those policies kind of working in the community on the ground level. And that would include participation with the recovery coaches and the care manager related to this program, as well as Leanne. So the entire team meeting with the law enforcement, Judd and Stephen, who are making referrals, those kinds of things. So again, we are looking for participation. We will get the policy work group up first, but just wanted to share that these 2 groups will be out there and will be soliciting to many of your organizations for participation. Brian, I see your hand up.
Yeah, thanks, Jolene. This is a great program. I'm super excited about it. I've heard you talk about recovery coaches a few times. I was wondering if you could speak to who you might be looking for to fill those kinds of roles and what training that they would get, and maybe where within the program they'd be located. Just trying to wrap my head around that a little bit more.
Sure. So all of the staff related to this program work under DBH. Leanne has set up a team. That team does include, again, a project manager, an outreach coordinator / care manager, and 2 recovery coaches. Again, the intent is the majority of these teams are made up of folks with lived experience. They do not require a certified peer certification for these programs. The training, we actually had to submit a full training plan. So we have training requirements prior to boots on the ground in connection with people within 90 days. And that training is very broad: CPR, safety training, ethics, diversity training, trauma-informed care. There's a very expansive list that we can provide if anybody is interested in seeing kind of what we're looking at. We are sponsoring some additional trainings in our region. We are sponsoring certified peer trainings if the staff are interested. It is not a requirement related to this program. And when we say where are they based, in the community.
Got it. Okay, thank you for clarifying. I didn't know if recovery coach meant somebody else other than the folks on the R.E.A.L team already, or because I've heard that term in other contexts. So thank you for clarifying.
Yes, and we've had some challenges related to language. So we moved away from the navigator language for the R.E.A.L program, specifically because of confusion as to the various types of community navigators out there. And as we went through that, was determined that recovery coach was the term best suited for the peer level community outreach support and engagement staff.
And both of our peer recovery coaches are certified as a peer recovery coach, so they've gone through the training.
Okay, so next slide. So
Who are recovery coaches?
Say that again, we didn't quite hear you.
Who are the recovery coaches?
Jamie Fowler is one of our recovery coaches, as well as Sarah Soper.
And so are they both from here?
Well, off and on. Yes, they've lived in Port Townsend off and on, but not necessarily from here originally. But yeah, they both live in Port Townsend currently.
Okay.
Sarah's been around a while.
okay, so this slide shows you some of the marketing materials we have. Leanne and her team have these cards available to share. So they are blue on one side. The blue speaks specifically to the R.E.A.L program. If you flip it over, it is green that speaks directly to if somebody is in more of a crisis than would be appropriate for the R.E.A.L program. We identify the R.E.A.L program as a crisis-like kind of pre-crisis service. If an individual is needing mobile crisis outreach as you would traditionally use, we would encourage that to continue. Mobile crisis outreach could then refer to R.E.A.L if that were appropriate. But often, I know particularly law enforcement is really aware this individual is probably not going to meet a whole lot of criteria under mobile crisis outreach or detention, but just really needs some support. Something isn't going right, and somebody to kind of walk them through whatever challenge they're having in that moment and move forward would be beneficial. Then we would look at that as a R.E.A.L referral. These cards are waterproof as well, so they're actually super cool. They're nice and sturdy. You can carry them in your pocket without damage. They can be shared across the community. And you'll see here, East Jefferson has the direct phone number, how to contact the R.E.A.L team, and then a little bit of the information to leave as well, the basic information that we discussed a little bit earlier, who is referring, the contact number, the location of the individual, and the information related to what you identify as their needs are. And again, Leanne has those, and you can coordinate with her to get those out to your community. And then next slide. These are the contacts for the R.E.A.L program. So here at the ASO, Marty Ann Lewis is our Recovery Navigator Program RNP administrator. So she is the administrator of the R.E.A.L program. I do backup for her. And then this lists also the Kitsap, Jefferson, and Clallam project managers at each of the agencies with the contact phone number as well as their emails.
Jolene,
Any additional questions?
Jolene, this may be covered in some future slides here. I forget, but when does the RFP for the next year of funding come out? And then when does the year start that it would apply to? And then who is eligible to apply for it?
Okay. So I did not have slides for that, but so we funded this program. There was an urgency to start by November 1st. We were the first program to start across the entire state with our first boots on the ground in early December. We anticipate releasing an RFP about the first week of March. So that is coming up very soon. That will be for the next 2-year period for this program. So funding for year 2 and 3. And that will be effective July 1st of 2020 through June 30th of 2024. And eligible entities, we are still in the works in determining what some of those parameters are.
Thank you.
So that will be listed, and everyone, we will share far and wide the RFP. That will have all that information, and we can directly share it with Lori to send out as well. We send it out to all of our contractors, many of our community partners, our tribal partners, So again, if you haven't heard anything, probably by the second week of March and you're interested, please reach out to Marty Ann or I, and we can make sure that you get it. We also do all of our RFPs through the Kitsap County Purchasing Department. So if you put in Kitsap Purchasing to your Google, it should come up, and it would be for the R.E.A.L program.
You know, I'm
Is that all
looking
the pieces of the question?
That was very good. Thank you. I'm looking around at the folks that we have on here, and I'm wondering if Richard Davies, who sort of comes from one landscape, or Chief McKern, who comes from a very rural landscape, if there's any questions that you guys have or concerns that you have as you look at what we're talking about here.
Jolene, if you could send that PowerPoint to Lori so we could get that out to our contacts at the south end, that'd be great.
I believe it is in the, okay, it's in the materials as well. And we would be happy to also come out and present, to be able to answer questions directly or set up a Zoom to do that as well.
Perfect.
Thank you. And then Richard Davies, any thoughts that you had as you think about how you could use that program? Or
I'm sorry, I'm not seeing this in our materials. I see the link to the.
It's in your meeting packet. It's maybe the third or fourth slide into the meeting packet. Can I put that link in the chat for you?
You did earlier, right?
I did, but here it is. Just a second here.
Oh, I see. Why did the other one I pulled up? Okay.
Found it?
I had it pulled up. I swear it wasn't in there. Okay. I'm fine. I'm fine.
So Lori has those slides, but feel free to reach out to me if you can't find them, and I can send them to you as well.
Some more Coca-Cola. I'll be fine.
And Richard, were you going to say something? I don't want to put you on the spot.
So I'm just super interested in the program, and we'll connect at a later date with the coordinator, and maybe have them come into our office and make a presentation, drop some cards off and the like, because it seems to me the idea is to keep people from getting into the criminal justice or criminal legal system rather, and reduce the amount of work we got to do. It's a great idea.
Yeah, we need some rest, and I want you to refer as many people as possible.
And we are very excited about this program because it definitely does assist people towards getting their needs met without impacting the other systems that both of you gentlemen work in. And that is the whole goal of this program, is to support these folks to be able to move towards recovery without all of the additional strings of legal involvement.
Absolutely. Yeah. I think of that as the moral aspect of it, to get people the help they need. Get on with things. Yeah.
I just would love to make a comment. So I have a little bit more statewide view of this work, and probably no surprise to all of you, the work being done by the Salish BHC-ASO to roll out this program is just stellar. So good job as always.
Thank you, Lisa.
So if we're done with this part of the program, does everybody have their questions answered? Come up with more? You know Jolene's address. Go ahead, Sheriff Null.
Sorry. I don't know if you have a new office, but I missed seeing that painting of the tire swing in the background.
I am at my actual office at the county here in Port Orchard. That tire swing is in my home office. I'm at Thursdays in my actual office these days. So it'll be back, no worries.
A lot of times what we talk about so nasty, I picture myself swinging on that tire swing while everyone else is talking.
It's a great picture.
Okay, if we're good to move on, Jolene, I think you're up again, this time for upcoming programs. Sharing screen. Any of this look familiar?
Like I should look at the slides ahead of time, shouldn't I?
They were in our last slide.
So Sorry, I'm having a hard time seeing it. Give me one sec. I'm stuck on one screen here at the office because my other one was not working today.
Oh,
Okay, so the mobile crisis team expansion for youth. So I can give a little update on that. We are still working out details both for Jefferson and Clallam County. An RFP was released January 14th for Kitsap County specifically. So the youth expansion requires the addition of a youth-specific crisis team. After going over our data, it was determined that the best place for that team is Kitsap County, and there is funding for a single team. So that RFP actually closes on the 17th of February. And our advisory board then will be reviewing those. The anticipation for this youth-specific crisis team in Kitsap County is to cover services from 7 a.m. to 11 p.m. 7 days a week with a child-specific trained crisis response team. That will not include a DCR. So we have, so they will work with the existing crisis teams as well. So our anticipation in both Jefferson and Clallam is that we will be working with the providers. So Jim and his team with Donette related to expansion of youth-specific staff to the current existing teams in both of those counties.
questions on that? I advanced it.
All right.
Did I too quick?
Do you want to go back? I think there's another piece.
Oh, sorry.
Yeah, so the expansion of the certified peer counselor. So again, focus on Jefferson. This is happening again in all 3 counties with all 4 of the crisis teams receiving funding to include a certified peer counselor in their crisis team. So there are some parameters that are required around peer services in crisis, one of which is that the peer is not the primary responder to a crisis. So they may be a secondary responder, respond with a mobile crisis outreach worker, and then could also independently provide crisis follow-up care for individuals who are accessing crisis services and need ongoing care. The funding for this is for about a half of an FTE. And we have been in talks with all the teams related to the addition of this role to their teams. That funding just rolled out in the contracts effective January 1st that are just hitting the streets. So I don't know if Jim, you have anything you want to add on that?
Yes, we are actively trying to recruit a certified peer for this. Currently, we have some certified peers that are going to help cover in the short term as a bridge, but there's quite a few new positions that we have to try to fill, and hopefully we'll get another one there. But we have people doing 0.5 here and 0.5 there, so it's kind of, we're braiding the positions as best as we can. So,
yes. Thank you. All right, next one. The peer Pathfinder transitions from incarceration pilot. This is a pilot program that has rolled out across the state. So they provided funding to augment the existing jail transition program. So the jail transition program, just a smidge of history, is an ongoing program that was specifically mental health focused for many years. Each of the 4 crisis or mental health agencies across our region have been providing services under this program. This adds, again, another 0.5 FTE peer to that team as well. So the goal of this program and the role is to provide pre-release or from release up to 120 days post-release support to assist individuals in re-engaging within the community. So it is really focused on individuals who have been incarcerated and helping them get back to the community and provide support in, again, any manner that they can, making sure that benefits are in place, that they can get back into treatment providers. They can assist with supporting family re-engagement, employment. There is a very broad range, but it is a peer-based service. So anticipated to be served by certified peer counselors who have lived experience in this area. And again, that's with Jim's team.
It's the other 0.5.
He's recruiting actively for that. We'll go on to the next one, the co-responder program. Oh, back that. Okay, thanks. So funding was received in the last, in our last contract from the last legislative session related to a co-responder program. This is a very limited pool of money. It is for one program across all of the 3 counties. So this is funding to provide a co-responder. We will be releasing this RFP also in March. Those eligible for this RFP would be law enforcement or first responder agencies that would then coordinate co-response within their organization. And so again, that will be released in March, and there will be one entity chosen from all 3 counties. So it is a very limited amount of funding that we are releasing in that RFP.
Just so I understand, so that funding would be, whoever gets that funding, it would be for funding in that county, or it's supposed to be?
It would be funding for that specific law enforcement or first responder entity, yes. So whichever county or whichever program is the successful bidder, there will be one.
And do you know?
Oh, I'm sorry, go ahead.
I was just going to ask, is the criteria how many people you're serving? I mean, is Jefferson County sort of on the low end of the priority at the end of the day, is what I'm asking.
We have not completed reevaluation of that. When we were looking at the co-responder rollout, it was really areas also that may have not been covered or served by a co-responder or navigator type model. But we have not put any parameters that said any entity or area is excluded at this time.
Okay, thank you.
And that goes through review with our advisory board that is made up of participants from all 3 counties.
Sheriff Knoll, did you have a question?
Well, I think you kind of answered it there. My question was, theoretically, that would be money so the sheriff's office could have a second navigator if it all worked out.
Yes, that would be how that would be anticipated.
Okay, thanks.
Okay, so R.E.A.L, we already went through.
I think that's everything on that topic.
Great. Thank you.
Any other questions before we move on? Okay, we're coming up at 3:53, so we'll bomb through these last few slides. At our last meeting, we had a lot of conversation about how we could better across our organizations get information out there about harm reduction and where folks can access services. And to that end, thank you to Lisa Ray Thomas, who connected us with Allison Newman. I was able to have JCPH's Liz Anderson, who's social media person there, and Anya Callahan, who you all met at our last meeting, meet with Allison, and we came up with some interesting ideas. Allison is from stopoverdose.org, so she knows a lot about educating organizations and communities around harm reduction. What we did know, though, was that we needed some really dedicated talent to take this communication action plan forward. And so I've asked Anya Callahan to come on board for a small contract at first to lay out, as you'll see here, the scope of services that we've put into the contract that we're asking for approval on from the Board of County Commissioners, would be to develop a communications action plan for Jefferson County, as this group of folks here works to end overdose deaths in Jefferson County. So we're looking for Anya to help us with research and analysis of the harm reduction issues to be targeted, some assistance in writing proposals and plans for digital communications, and some assessment and support for relationship building, insight generation, education, advocacy with the existing potential partners, allies that we have locally, in state, and then nationally. And I want to stress that this is all advocacy, or this is all education, not they have a rule in the HRSA grant that you cannot go advocate for a specific position. I think we're just making it a point to go out and educate folks on what's going on. So I'm looking at that wording there and realizing I better take that out before HRSA notices that. And then the approach will be for Anya to prepare an initial assessment of the harm reduction landscape and to help us articulate a top priority. Then we're going to develop a specific action plan to address that priority and initiate execution of those actions that we've come up with. And I want to say right now, I recognize this is a scope of work that covers just starting this work. So while I have approaches and deliverables listed here, we recognize that we're just going to get started between now and May. The work is going to need to go beyond that. We're not going to have finished probably any one piece of this, by May, but I want to make significant progress that we can report back to you at each meeting that we have going forward. So the way we sort of listed it out for each month, we sort of have a finish date for initial assessment. We hope to have something to report to you in March. We hope to report, or I guess that would be in the April meeting, we hope to report something about an action plan. And by the April meeting, by the May meeting, we'd look to give you some insight to what we're getting underway. And I know all of this will require working with your different organizations and the sort of social media or what ways work to get a consistent message out to the channels that you want to get it out to. So we'll be talking with you, I'm sure, often as we're going through this process. And then I wanted you to see the budget that we put in there is just under 2,500. And in part, that's because you can get a contract approved to pull grant money out, which I had a large sum identified and approved to handle communications, but I didn't have a specific contractor identified. So now that we've identified Anya, I wanted to be able to go after that contract without having to put it out for RFP. So in order to do that, you put it under 2,500. And then as that works out, we'll look at bigger contracts covering bigger scope of work. Are there any questions there? And then I should ask Anya if there's anything she'd like to say. I'm going to start with Sheriff Knoll's question.
Maybe I might have missed this. That $2,400, where does that money come from?
That's from our HRSA grant. I don't know if you remember the grant that we had that, funds prevention, treatment, recovery. Yeah, it's coming out of that. So there was a big sum in there allocated for a communication action plan that would both raise the profile of the Behavioral Health Consortium and address stigma in our county. And so this is where we're pulling some of that funding from.
Thank you.
And then Anya, was there anything you wanted to say?
Just grateful to be here and for these resources and to be witnessing these meetings. And I'm hopeful about the work we can do together. So I'll definitely be sharing my contact and feel free to reach out to me if you have ideas or things or discussions you want to have with me. So thank you.
I'm excited that Anya was available and looking forward to getting to work with her. We are at 3:59. Just quickly let me say that our behavioral health data timeline, usually by the end of this month, I'm starting to come back and ask folks for PIMS data and other sorts of data. We've gotten word from HRSA that they're changing up a little bit the different measures that they're looking at. So they're going to see if they can sort that out. Perhaps I'll be coming back to you in May asking for data that's specific to that regular time frame. I'll tell you more as I know more, but the bottom line is I'm not going to be calling you this month. So I guess you should be happy. I just wanted to highlight that I did put the link in your packet for the syringe services program survey that the ADAI did. There was a lot of information in there. I'm sure there'll be other webinars where they sort of delve into it, but I wanted you to see the slides. And then I think I put in here a bunch of bills that we're tracking that you could look at if you were interested in. And then next month, we'll tell you about another R.E.A.L grant that we're looking at going after. And I'll dig into that by next meeting, but I'll probably be focusing, coming back to to several of you as I start to put together what that work plan might look like. Are there any questions before I let you all go? Okay, everybody's sufficiently numb. Go forth. Have a great afternoon. Thank you for being here.
See
Thank
everyone.
you, Jolene.